Hello everyone. I am Dr. Achla Ingli. I'm MBBS and MD in General Medicine. And as you have been watching my videos or you are new to this channel, I am a doctor who is introducing you to all the topics that are very useful to in our day-to-day life. And we are here to treat our patients. We are here to understand the topics and to apply them in our daily practicing medicine. So I have made so many videos in response to making understand the topics in a bit of depth. These are all my handwritten notes. I have been using multiple textbooks. So this might help you people to prepare in NEET as well as NEET PG or in NEET super specialty. Okay, so in previous topic, I did utter about Sjogren's syndrome, and so I thought, why not discuss it today and have a detailed discussion on the Sjogren's syndrome. So today's topic would be Sjogren's syndrome, which is under rheumatology. Yeah, so it is actually a second most common rheumatological disease. Okay, and we all are aware of this. Okay, and why is it so very important? Because as we are all aware, we have the renal tubular acidosis, which is associated with distal RTA, and this is very important for us so that we can diagnose the patient and we can have a proper aspect of it. And yes, now Sjogren's syndrome has been divided into primary and a secondary Sjogren's syndrome. When you talk about the secondary, it means because of certain disease. So I have made a mnemonic saying RIC, that is rheumatoid arthritis. The second thing is the inflammatory muscle disease, and the third thing is the granulomatosis with polyangiitis. So Sjogren's syndrome is having a glandular subtype and an extraglandular subtype, which is common, which is 50% of the patients, and 15% of them they have a very severe form. Okay, it is actually a autoimmune exocrinopathy, which is involving a periductal and a perivascular inflammation. So the CD4 T cells are more importantly involved over here than the B cells. So it is very important for us to know this because it will help us to differentiate between rheumatoid arthritis. We can help it to differentiate between SLE. Okay. So when we talk about the periductal, there is an activation of the ductal epithelium where there will be immune destruction, and the thyroid gland is also involved because in this, and as there is actually antibodies, say anti-MR3 and anti-alpha 14 antibodies. So, who are the people who are affected? This is mostly a female disease, 9:1 popular ratio, and between the 40 to 60 years of the age group, we will see that reproductive age group, right? Okay, so we have a genetic factors which are actually DR2, DR3, just like an SLE. Okay, and environmental, we have a salivary gland virus, which is actually it is a contradictory statement. Some people are saying that there would be a salivary gland virus, that is a CMV virus, which will be involved, but other textbooks say that there would be no virus involved in the Sjogren's syndrome. So be careful in the question if the MCQ says that there is a parvovirus, there is a CMV, or there is a EBV. Okay, so EBV is associated with, say, SLE. Parvovirus is associated with rheumatoid arthritis. Now, CMV is associated with that of Sjogren. So remember it very carefully. Now, if the question says is not associated, it depends upon the examiner what he wants you to know. Okay, so it's a bit a tricky one. Then if the glandular one is involved, so there is, say, a dryness of the eyes, keratoconjunctivitis sicca, okay, with the dryness of mouth, very very important, and we are also aware of that, right? So in the glandular symptoms we have dry eye and dry mouth. Okay, so salivary gland enlargement will be there, which is mostly a complaint because dryness of the mouth and dry eyes are not very much a symptom, because dryness of eyes could be one of the symptoms, but the dryness of the mouth is little bit, people are not people are really ignorant about it. So there will be a bilateral painless symmetrical form salivary gland enlargement. And yes, we are doing a Schommer's test. we are aware of that. Then we have a Lissaman green stain then on so that we can stain the mucin defect areas in this. Okay, and there is a dye vitalized epithelium also. Okay, so fluorescent dye, okay, dye vitalized epithelium is there, and the tear film breakup time, say it should be less than that of 10 seconds. When it comes to the dryness of the mouth, there will be an altered taste, there will be a dental caries, and there will be oral thrush. Okay, so there will be also a deep red tongue. So this is more specific dryness of mouth. Okay, and there will be a parotid gland enlargement. Okay, so this is becomes very important differential, one of the differentials being the our IgG4 disease. Okay, so I will go through the IgG4 disease also. I will make a video on that also, because how to differentiate between the IgG4 disease and that of the Sjogrens. But remember, there will be a parotid gland enlargement over here, and there is increased risk of marginal zone lymphoma, any hard mass, nodule, yes. So that you have to suspect there is a marginal zone lymphoma. Recurrent episodes of acute parotitis due to the duct blockade in a childhood, and in case of the adolescent Sjogrens, we can be visible. Now, if we see, there would be a extraglandular symptom, which is most commonly, it is the fatigue. Now this is the most common that of the symptom, right? Remember this fatigue. Okay, so 50% of them they can have a 15% of them they can have a severe form. We have already learned that. Now coming to that of the anti-Rho and anti-La. So this is very important, Rho and La. Okay, so in case of the SLE also we can get anti-Rho and La positivity, but when it is a positive, so remember that is a minimal disease, we can say. So secondary, it is secondary Sjogren's syndrome and SLE. So there is decreased risk of nephritis and vasculitis. There could be a neonatal lupus with a complete heart block and associated with subacute cutaneous lupus. Okay, so these 3 points are very important. Whereas when it is associated with that of the Sjogren's, now this is an early onset, longer duration, extraglandular manifestation, poor prognosis, increased risk of lymphoma, and there will be a persistent salivary gland enlargement. That means this is a bad disease in case of the Sjogren's syndrome when it is a Rho and La positivity. Okay, so rheumatic factor will be also positive, and of course this Sjogren's is associated with cryoglobulinemia, and which will be having low C3 and C4 count. Okay, and 85% of the Sjogren's will have ANA positivity, and like that of the SLE, where there will be 98% positivity, but here only 85% positivity. So remember, if the ANA is negative, do not rule out Sjogren's. You have a high suspect of Sjogren's. Okay, so extraglandular manifestations, we have fatigue, which is most common. Many books have been given as a symptom as a arthralgia, but no, it is the fatigue which is more common. There is a bilateral symmetrical small joint polyarthritis. It is a non-erosive type of arthralgia if it is there, and it is the arthritis, and the deformities would be because of the laxity of the ligaments. Okay, now there could be a Raynaud's phenomenon as well. So it could be a primary or a secondary one. Secondary, if it's saying we have a systemic sclerosis and we have a Sjogren's syndrome. Okay, and Raynaud's phenomenon, we all are aware. Okay, so that would be seen. Then we have a vasculitis, small vessels, cutaneous, non-thrombocytopenic palpable purpura. Okay, and cryoglobulinemia, which will be low C3 and C4. So there will be vasculitis, there will be ulcers, there will be MPGN, glomerulonephritis pattern, and there will be neuropathy. So coming to the head to foot manifestations, we will expect on MS-like lesions. Now this is really rare. The textbooks say this is a MS-like lesions. Okay, and peripheral, we will be having a ganglionopathy, Sjogren's, and paraneoplastic syndrome. Remember, okay. So asymmetrical, it is the posterior column which is involved, and there would be truncal ataxia. So in the lung, this is very important. There will be NSIP pattern. Okay, but remember what subtype? It is a lymphocytic interstitial pneumonia. MCQ has been previous year MCQ has been there on this, and it is seen in HIV as well as in the Sjogren's. So what will be there? There will be a ground glass opacities, thin walled cysts, and central lobular nodules. In the liver, we will be expecting as the Sjogren's is there, we can expect few things with hepatitis C being positive, porphyria cutanea tarda, cryoglobulinemia, and lichen planus. You can have the mnemonic about it. I have created my own. Okay, now when it comes to biliary system, Primary biliary cirrhosis can be expected in such patients. In the kidneys, there is a membranoproliferative glomerulonephritis we have already seen, cryoglobulinemia, and there will be distal type of the RTA. Okay, so ANA will be positive in the Sjogrens in the 85% of the patients, and if it is there is a speckled pattern. Okay, so how will you diagnose the patient? But depending upon the head to foot examination as well as his symptoms of the bilateral parotid gland enlargement, or say any hard mass, marginal zone lymphoma, or if the patient is a hepatitis C positivity and you see few symptoms, ganglionopathy here and there, then you have to suspect the patient. We can go with a label biopsy, which is a gold standard. Okay, of course the ANA has to be performed in such patients. Okay, coming to the treatment part, treatment is like salivary substitutes like eye substitutes could be used. Okay, and then could be a cyclosporin or can be used. Okay, certain cholinergic agents could be used. And the extraglandular one, of course we have to go with the steroids. We can go with the NSAIDs because of the arthritis, hydroxychloroquine. For the ILD patients, we can go with the steroid cyclophosphamide. Okay, so this is in a nutshell Sjogren's syndrome. I hope you have got certain idea about Sjogren's syndrome. Please do read about it from Harrison, and you can just compare and contrast the things, right? And let me know if any other topic you want to really understand. I can just try and make you understand such topics with my handwritten notes. Thank you for watching.